This week on Healthy Living, December 1st is World AIDS Day, and we will look at progress, challenges, and opportunities in the fight against HIV/AIDS. Kenya works towards the ambitious goal to eliminate HIV/AIDS by 2030. Plus, an exclusive interview with Ambassador John Nkengasong, the U.S. Global AIDS Coordinator. Finally, in our segment Eye on Outbreak, West Africa fights diphtheria while the Democratic Republic of Congo faces Monkeypox and Zimbabwe fights to contain cholera. Thus, in this edition of Healthy Living. Hello, I'm Lina Khmudu. Thank you for joining us for another episode of Healthy Living. The first World AIDS Day was commemorated 35 years ago. The global observance provides a platform on December 1st of each year to raise awareness about HIV and AIDS and show support to those who are affected by the disease. The theme this year is World AIDS Day 35, Remember and Commit. The World Health Organization says HIV has claimed over 40 million lives worldwide and remains a major global public health issue. There is still no cure for HIV. However, experts say people can live long and healthy lives if they have access to prevention tools, diagnosis, treatment, and care. WHO data reveals that about 39 million people were living with HIV at the end of 2022, with 2/3 of them in Africa. Let's begin in Kenya, where 1.4 million people are living with HIV. The country is grappling with high infection rates as it ranks 7th on the continent. Kenya has made significant progress over the past decade toward reducing HIV. There is a reduction of 78% in new infections and a 57% decrease in AIDS-related deaths. Kenya aims to eliminate the pandemic by 2030. Juma Majanga reports from Nairobi.
In Dandora neighborhood in Nairobi, we meet Lucy Wanjiko at work. Wanjiko says she felt like her life was torn into pieces 13 years ago when, as a teenage mother, right from high school, she tested positive with HIV. Her child died 2 weeks later. She picked up the pieces of her life, and years later, she used them to build Positive Young Women Voices, a community-based organization that advocates for and supports girls and young women affected by HIV in the same neighborhood that she grew up in.
There's a girl somewhere, the same way I felt I had no one to hold my hand, probably needs me now to come in and hold her hand. Probably listening to my story, she'll make better choices than the ones I did, and she won't have to go through what I had gone through.
Since the discovery of the first HIV case in Kenya 4 decades ago, the country has made significant strides in improving HIV care over the years.
For example, in 1996, we had a prevalence of around 10.3% in the country. Right now, we are talking about 4.9%. So that's a very, very big impact. There's reduction in mortality, there's reduction in morbidity. So we are not in the era where you see someone who looks skinny, emaciated, and you're like, oh, that is HIV/AIDS. I mean, people are living healthy and able to mingle with everyone else without their status being known.
Of the 1.4 million people living with HIV in Kenya, 1.1 million are enrolled on antiretroviral therapy, with 73% of them achieving viral suppression, according to the country's Ministry of Health data. The data also indicates that the number of new infections has slowed by 78% and AIDS-related deaths reduced by 57% over the past decade. Kenya aims to eradicate HIV by 2030.
The U.S. President's Emergency Plan for AIDS Relief, PEPFAR, was established in 2003. Since then, over $100 billion has been invested in the global HIV/AIDS response through PEPFAR, saving 25 million lives and preventing millions of HIV infections, according to U.S. government data. For more on the fight against HIV/AIDS and the impact of PEPFAR, particularly in Africa, we spoke with Ambassador John Nkengasong, U.S. Global AIDS Coordinator and Special Representative for Health Diplomacy.
The PEPFAR program is a great symbol of solidarity and care from the American people to the continent of Africa. If we just imagine 20 years ago, what HIV was doing on the continent of Africa, the public health experts and doctors could diagnose HIV, but that was the end of the story. It was a death sentence. PEPFAR came in and in 20 years has saved about 25 million lives, prevented HIV infections from infected mothers to infants in the tune of over 5.5 million. So I don't know of any intervention in the history of infectious diseases in this decade that has led to such a significant impact and outcome. Public health infrastructure and systems have been significantly strengthened in Africa. We've supported the establishment of over 3,000 laboratories in Africa. Over 340,000 public health workforce have been trained, and about 70,000 healthcare facilities have been strengthened in Africa. So because of what PEPFAR has done, in several countries, they now have the ability to use that same infrastructure to respond to other disease threats like measles, cholera outbreaks, Ebola, COVID just recently. COVID was a test case of what infrastructure, public health infrastructure can do for countries that have them versus countries that do not. During HIV response, where we've made progress, and countries that have made significant progress are countries that have embraced the community very early on. Communities are taking a lead on testing, and so that people know their status. Communities are taking a lead on treatment, that is making sure that people stay on treatment, and community are counseling and informing their fellows as citizens in the settings they are, what it means to keep your viral load at below suppression. Without the communities, there is hardly any vehicle that can reach a broader audience. When community leads, we make progress.
The National Survey on the Impact of HIV and AIDS in Mozambique 2021 reveals that 1 in 4 women between the ages of 35 to 39 is infected with the HIV virus. Associations like Kindlimuka are working to raise awareness to encourage testing and increase retention levels in antiretroviral treatment. Amaryllis Gule has more.
Albertina Temele has experienced loss in her life. Her husband passed away in 1996. When the reason for his death was revealed, Tamele and her daughter were told to get tested for HIV.
They told us we were HIV positive, and it wasn't easy to hear that, not for me, but because my child was only a year and 10 months. I started thinking such a small kid having to go through treatment for life. It's hard.
First, her husband died, and then her daughter. Tamele was diagnosed in 1996 with HIV, but she didn't start the treatment until 2004. She was then in a new relationship and had a son who was also HIV positive.
We're doing the treatment as it should be, and thank God both he and I have undetectable viral load. We do it every day.
HIV prevalence in Mozambique remains one of the highest in the world, with around 2 million adults living with the disease. According to the National Survey on the Impact of HIV and AIDS in Mozambique, or NCINDA 2021, 1 in 8 adults is living with HIV, and women account for 15% of cases. Alice was invited by an activist to take an HIV test during a lecture. To their surprise, The result was positive.
When I got the results, I left and cried. It wasn't easy. I had the courage to tell my cousin, but I didn't tell my parents until today.
At the Kindimuka Association, people living with HIV get the support they need to keep going. The association pledges to help vulnerable communities affected by HIV/AIDS through raising awareness, enabling access to treatment, and fighting stigmatization.
We work with people living with HIV and AIDS, orphaned and vulnerable children. We look more closely at what they need so that together we can try to bring about a response for them.
Albertina and Alice's stories are common around the country. NCEDA 2021 points out that 1 in 4 women between the ages of 35 and 39 is infected. And of those who know their HIV status, 97.5% are on antiretroviral treatment, or ART.
Lanice Williams is a global health and gender consultant. She discusses her experience working to fight HIV/AIDS in the United States, Africa, and beyond. Lanice, welcome to the show.
Thank you, Lenore.
What is your assessment of the HIV epidemic and how far we have come?
As we saw in the recent UNAIDS report that was released this summer, we've seen countries like Botswana, Eswatini, Rwanda, as well as Tanzania are now achieving the 95-95-95 UNAIDS targets, which basically means 95 people that are living with HIV know their HIV/AIDS status. 95% of people that know their HIV/AIDS status are on treatment, and then 95% of people that are living with HIV are virally suppressed. I think particularly around adolescent girls and young women, we really need to do a lot more programming around addressing a lot of the gender inequalities and societal norms that further exacerbates HIV infections among adolescent girls and young women. Particularly, we need to make sure that we are addressing things around gender-based violence prevention and response, and making sure that's integrated into HIV prevention programming, from preventing gender-based violence, but also how you respond to gender-based violence. We know a lot of strategies around ensuring that adolescent girls and young women continue to stay in school are helpful, particularly ensuring reducing their risk of GBV, but we also know that some programming are really focusing on addressing some of these inequalities that exist within societies. How are you engaging men and boys as advocates and allies to ensure that you're also preventing the transmission of HIV? And for this year is Let Communities Lead. And we need to ensure that when we're talking about prevention, treatment, and care, that we're incorporating in communities. Taking a community-based approach, I think, is going to be pivotal to ensuring that we not only stay on track, but we also meet the 2020 targets of ending HIV/AIDS. But I think the financing piece and having more political will and civil society organizations are also key.
Authorities in several West African countries are stepping up their effort to contain a huge diphtheria outbreak. Nigeria has embarked on a vaccination campaign for millions of people to cover wide gaps in immunity against the disease. Over 11,000 people in Nigeria have been diagnosed with diphtheria, and at least 573 have died since the current outbreak started in December 2022. Guinea is reporting 58 deaths and more than 495 cases since its outbreak started in June. Meanwhile, the World Health Organization says it has confirmed a sexual transmission of Mpox or Monkeypox in Congo for the first time as the country experiences its biggest ever outbreak. According to the UN Health Agency, a resident of Belgium traveled to Congo in March and shortly after tested positive for Mpox. Finally, Zimbabwe's government is imposing restrictions on public gatherings and food vending as cases of cholera soar in the country. Government data reveals that new cases of the disease jumped from 437 to over 1,200, the biggest increase since the outbreak started in February. In addition to the restrictions, the government is also monitoring burials in all affected areas. Authorities last week declared a state of emergency in the capital, Harare, which has the highest number of new infections. Thanks for watching Healthy Living. For the latest news and coverage, stay connected to Voice of America at voaafrica.com. You can follow me on X, formerly known as Twitter, @linochmudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.